Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hi, everyone. I'm Nario Cantu, pharmacist and owner of Cantu's Pharmacy, and I want to welcome you to another episode of the Friendly Pharmacist podcast. This is the place where we break down everyday health questions, talk about the medications you rely on, and help you feel more confident in taking charge of your well-being. Whether you're a patient, a caregiver, or someone who just wants to understand your health a little better, I'm glad you're here. Let's dive in and make pharmacy simple, approachable, and friendly, just the way it should be. When we talk about taking control of your health, one of the most empowering steps you can take is truly understanding your medications. But the truth is, most people don't feel confident about what they're taking, why they're taking it, or how to use it correctly. And that uncertainty can sometimes lead to mistakes that are completely avoidable. So today, I want to slow things down and give you a clear, friendly walkthrough of everything you should know about your prescriptions in a way that feels simple, practical, and easy to remember. Let's start with the basics. The prescription label, think of it as the instruction manual for your medication. It includes your name, the medication name, the strength, and how often you should take it. But beyond that, there are usually several small but important notes many people overlook. Labels may tell you to take the medication with food, avoid certain beverages like grapefruit juice, or use caution when driving. They may tell you to store the medication at room temperature or keep it away from moisture. These little instructions can have a big impact. For example, taking certain antibiotics on an empty stomach helps them work better. Some medications lose potency in bathroom humidity. And a drug like Benadryl, which is found in many nighttime products, can cause drowsiness that makes driving dangerous, even the next morning. Dosing instructions are another area where confusion is extremely common. A prescription might say, take twice daily, but that doesn't always mean exactly every 12 hours. Some medications need consistent spacing for best results, while others can be taken at times convenient for you. And when a label says take as needed, it's important to know what that actually means. For instance, as needed for pain doesn't mean take it every hour. It usually means take it only when necessary and never exceed the maximum daily amount. Your pharmacist can translate these instructions into plain language and help you tailor them to your daily routine. Understanding the difference between brand name and generic medications is another key piece of the puzzle. Every medication has a generic name, the actual drug, and a brand name, which may vary depending on the manufacturer. Knowing the generic name helps you recognize your medication, even if it looks different or comes from another pharmacy. It also prevents accidental duplication. For example, someone might take Tylenol for pain relief and also take a cold medication containing acetaminophen without realizing it, unknowingly doubling the dose. Simple awareness can prevent serious complications. Let's talk about interactions, one of the biggest areas patients overlook. Supplements like St. John's wort can interfere with antidepressants. Grapefruit juice affects how many drugs are absorbed. Taking ibuprofen with certain blood pressure medications can reduce their effectiveness. Even everyday things like caffeine, alcohol, or dairy products can change how a medication works. It's not about memorizing all the rules. It's about knowing when to ask. Quick conversation with your pharmacist can save you from a lot of trouble. Mistakes also happen when patients stop medications too soon or skip doses. For example, antibiotics should be finished even if you feel better, because stopping early allows bacteria to come back stronger. Blood pressure medications need consistency to work properly, and for many chronic medications, missing doses can make your symptoms flare back up. Setting reminders on your phone, keeping your medications in a visible spot, or using pill organizers can be powerful tools for staying on track. Storage is another underestimated aspect. Heat and humidity can damage medications. Leaving pills in a hot car or storing insulin outside recommended temperatures reduces effectiveness. Even keeping pills in the bathroom, where most people think they belong, can shorten their lifespan due to moisture. A cool, dry cabinet is usually the best spot. And one more thing, communication. The biggest favor you can do for yourself is building a relationship with your pharmacist. We are one of the most accessible healthcare professionals you can reach. You don't need an appointment. You don't need to wait weeks, whether you're unsure about how to take a medication, worried about a side effect, or curious about alternatives. Your pharmacist is right there, ready to help. At the end of the day, medications are powerful tools that improve quality of life, but only when they're used correctly. Understanding your labels, asking questions, staying consistent with dosing, and knowing what to avoid can dramatically reduce risks and improve outcomes. Your health is too important to approach on autopilot. So take the time to understand your medications. And remember, as your friendly pharmacist, I'm always here to help guide you every step of the way.